In this video we will show you natural ways to cure viral fever. Drink lots of water and keep yourself cool and comfortable. Get plenty of rest and take some fever-reducing medication. Visit your doctor if your fever exceeds 103-105 F and hasn't gone down in 72 hours. Make some changes to your diet, such as avoiding inflammatory foods and eating more anti-inflammatory foods. Lastly, consider some herbal remedies, such as drinking herbal tea or adding cayenne pepper to soup. Method 1. Making adjustments to your home environment. 1. Drink lots of water. Aim to drink at least 8 ounces of water every 2 hours. Your body can quickly lose moisture and get dehydrated by sweating or sneezing caused by illnesses, such as colds and flu, that are often associated with a fever. 2 liters of water is the daily recommendation for the average adult. Caffeinated beverages in moderation are generally fine, but make sure they are not your only source of fluids. Sports drinks are acceptable liquids for rehydration, but use carefully. While these drinks do provide electrolytes, it is usually far more concentrated than necessary. 2. Wear comfortable clothing. Wear loose, comfortable clothes when you have a fever to help your body relax and improve air circulation to help you stay cool. Remove excess clothing or blankets that can trap heat and make a fever last longer. Try 1 layer of lightweight clothing and 1 lightweight blanket or sheet for sleep. Natural fibers, such as cotton, bamboo, or silk, often breathe better than man-made fibers like acrylic or polyester. 3. Lower the room temperature. High temperatures can make a fever last longer and cause excessive sweating that can lead to dehydration. The room temperature should ideally be 73 to 77 F. If the room is hot or stuffy, a fan may help. 4. Get plenty of rest. Getting enough rest helps your body heal faster by strengthening the immune system. Avoid moving around too much. Take some time off work to get even more sleep than you usually do if possible. Studies show that sleep deprivation can weaken the immune system, increase the production of stress hormones, put you at higher risk for chronic disease, and lower life expectancy. For more information on how to create a better sleep schedule, check out How to Sleep Better. 5. Take a fever-reducing medication. If the fever is very high or causing you serious discomfort, you can take a fever-reducing medication. Several medicines target fevers: acetaminophen, ibuprofen, and aspirin, for instance. Take these over-the-counter medications as the label suggests to help bring down your fever. Check the dosing carefully. Take the smallest dose possible to relieve your fever. Children under 18 should not take aspirin unless specifically recommended by a doctor. It is associated with the development of Reye's syndrome, a disease that causes the brain and liver to swell. 6. Take a warm shower. A warm shower or bath that lasts for 5-10 minutes can help stimulate sweat that keeps your body cool, soothes sore muscles, and decongests sinuses that may be blocked due to a cold. Make sure the water is not too hot to avoid increasing your core temperature, which may cause the fever to last longer. Keeping your body clean can also help reduce the risk of further viral or bacterial infections. 7. Sponge down. If bathing facilities are not available or do not sound appealing, use a moist towel instead. Soak small towels in lukewarm water and dab them on your forehead or under your arms. This stimulates sweat that helps keep your body cool, improves blood circulation and can reduce nasal congestion caused by a cold or flu. Using cold water, an ice pack, or taking a cold shower can induce shivers, which can increase the core body temperature, making the fever last longer. Do not apply warm towels to an injury or inflamed skin, as it can cause bleeding and further inflammation. 8. Keep your nose clear. If your fever is caused by a cold or flu, it's important to keep your nose clear to breathe comfortably. Difficult breathing can increase your fever. Do not blow your nose too hard. as the pressure can give you an earache on top of the cold. Be sure to blow gently and only as often as necessary. Experts recommend that you blow by holding a finger over one nostril and gently blowing the other into a tissue. If your child or infant has a cold, help them blow their nose correctly. Wash your hands each time you blow your nose to avoid chances of other infections by bacteria or viruses. 9. Stay indoors. Unless you're already outdoors when your fever comes on, it is best to curl up and rest indoors where the air is dry and the temperature won't change much. If you must be outdoors while suffering from your fever, stay in the shade and limit activity. 10. Avoid smoking. In addition to the risks of lung cancer and other respiratory diseases, smoking also suppresses the body's immune system. Smoking thus requires the body to fight harder against viruses and bacteria, which increases body temperature. It is best to avoid exposure to cigarette smoke, nicotine, and other tobacco products until your fever has reduced. Children, especially infants, should not be exposed to second-hand smoke, especially while they have a fever. 11. Reduce caffeine intake. Too much caffeine can be bad for you when you have a fever. Caffeine overdose can cause fevers, headaches, insomnia, diarrhea, irritability, and dizziness. Caffeine also stimulates water excretion, and excessive intake can lead to dehydration. When you have a fever, try to avoid caffeine or lower your intake to 100 mg. 12. Avoid alcohol. You should abstain from drinking alcohol, whether it is beer, wine, or another drink when you have a fever, regardless of severity. Alcohol weakens the immune system, making it harder for your body to recover quickly. 13. Do not use rubbing alcohol. Applying rubbing alcohol on your skin makes your skin feel cooler. However, it is a very temporary sensation. This cooling effect does not help when you have a fever, as it can cause shivering, which raises your core body temperature. In addition, the skin can soak up alcohol. For small children, and infants in particular, this approach can increase the risk of alcohol poisoning. 14. Visit your doctor. Though you can treat many fevers at home, there are specific situations in which you should leave the care to the professionals. If you have a fever between 103 and 105 F that doesn't come down with an over-the-counter medication, such as ibuprofen and aspirin, or a fever of any temperature that lasts over 72 hours, then you should see your doctor immediately. Children under 3 months with any fever. Children under 2 with a high fever, or a fever that lasts more than 48 hours. 15. Differentiate between a fever and other activities that raise body temperature. Physical activity, mood swings, hormonal changes, irregular or heavy eating, tight or heavy clothing, medications, and exposure to high temperatures can also increase your body temperature. If you suspect you have heat stroke, you should call 911 and seek medical care immediately, as it can lead to seizures and heart attack. A raised temperature can occur with heat stroke, but this condition must be treated differently. If you think heat stroke might be the actual problem, then you can find more information at how to treat heat stroke. 16. Determine if your child should see his or her pediatrician. You may want to talk to your doctor for children with lower fevers than you would for an adult. Always consult a pediatrician before giving a child a medication for a fever. You should additionally seek medical care for your child if the child is younger than 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. Is 12 months old and has a fever of 102.2 degrees Fahrenheit, 39 degrees Celsius, or higher. Is underage 2 and has a fever that lasts longer than 48 hours. Is not alert, cannot be awakened easily, has had fevers come and go for up to a week or more. Thanks for watching. Subscribe our YouTube channel for more videos.